All right, let's talk about something that gets people really fired up in the world of manual medicine, the vertebral subluxation. It's a term that sits at the center of a huge, long-running debate. And today, we're going to unpack what the medical literature itself actually says about it. So, on one side, you've got this core concept in chiropractic. And on the other, you have mainstream medicine often just brushing it off as pseudoscience. But here's the twist. What if it's not that black and white? What if these two seemingly opposite camps are actually talking about the very same thing, just using a different label? So, how do we even begin to figure this out? Well, the paper this explainer is based on kicks things off by pointing out a really fascinating contradiction, one that's hiding in plain sight within the scientific literature. Okay, now get this. The authors here are pointing out a massive double standard. They're saying, look, there's a pile of evidence, physiological data, that's used to prove medical manipulation works. When doctors use it, it's accepted as solid science. But when chiropractors present that exact same evidence for their work, it's often just ignored. It's a scientific inconsistency that really makes you ask why. To really understand that contradiction, we've got to make sure we're all on the same page. We need to define what we're actually talking about. And it turns out the very definition of subluxation is a huge part of the problem. The traditional, really simplistic view basically boils it down to this. A bone is just a little bit out of place. But the paper argues this is, well, way too simple. It's like describing a complex car engine by just pointing to a single screw. It might work if you're looking at a dry skeleton in a classroom, but for a living, breathing person, it just doesn't cut it. And this analogy just nails it. Think about it. No one would ever describe a sprained ankle as just a displaced bone. You'd be completely ignoring the torn ligaments, the swelling, the pain, the fact that you can't walk. You'd miss the entire clinical picture. The paper argues the simple definition of subluxation makes that exact same mistake. And that leads us to the much bigger, more complete model, the Vertebral Subluxation Complex, or VSC. The key word there is complex. See, it's not always about a bone being physically out of place. It's about dysfunction, a joint that isn't moving or working the way it should, which then kicks off a whole cascade of other changes. So what does this complex actually look like? Well, the VSC model breaks it down into 5 interconnected parts. It all starts with kinesiopathology, which is just a fancy way of saying the joint's motion is off. That leads to neuropathology physiology, meaning it starts affecting the nerves. In turn, that can cause myopathology, or changes in your muscles. Then histopathology, which is actual damage to the tissues. And finally, biochemical changes, like inflammation. So you see, it's a whole process, not just a single static problem. Okay, so if this vertebral subluxation complex is a real thing, where's the proof? Where's all this evidence hiding? Well, according to our source, it's not so much hiding as it is scattered all over medical literature, just under a whole bunch of different names. And this is where it gets absolutely wild. The researchers found over 500 synonyms and related terms being used in medical, osteopathic, and physical therapy papers to describe what seems to be the exact same thing. 500. You can't just dismiss a concept when that many different clinicians are clearly seeing it and trying to label it. Let's look at just a few examples. An osteopath might call it somatic dysfunction. A medical doctor could refer to an intervertebral derangement. A physical therapist might diagnose joint dysfunction. And a chiropractor might use vertebral fixation. You see? Different professions, different terms, but they're all pointing to a similar problem. A part of the spine just isn't working right. And hey, this isn't some new debate. This little snippet from a medical text shows that way back in the early 1900s, the medical community itself recognized that these subluxations were a valid scientific topic directly connected to nerve problems. This wasn't some fringe idea. It was part of the scientific conversation. So we've seen the history, we've untangled this web of different names. But what happens when we go right to the very top? Let's see what the highest level of international medical classification has to say. The question is pretty simple. What does the World Health Organization, the WHO, think about all this? Is subluxation even in their vocabulary? Well, would you look at that? Here it is. The WHO provides definitions for both subluxation and subluxation complex. And pay attention to the wording. They define it as a lesion or dysfunction where movement and function are altered. The complex definition goes even further, explicitly mentioning the interplay of nerves, muscles, and other tissues, which sounds almost identical to that 5-component model we just saw. But this right here is the real smoking gun. In the International Classification of Diseases, the ICD-10, which is the global standard for all medical coding, the WHO gives these conditions their own specific codes. You've got M99.0 for segmental and somatic dysfunction, and right below it, M99.1 for subluxation complex. They are listed as distinct, classifiable clinical problems. And just to be crystal clear, this isn't some minor footnote. These are officially classified right there with all the other recognized diseases of the musculoskeletal system. So, according to the highest global health authority on the planet, this concept is a recognized clinical entity. So, if the condition is being observed by multiple professions and it's even officially classified by the WHO, then what is all the fighting about? This brings us right back to the central theme of this whole thing, the great naming debate. This quote from Dr. Carl Levitt gives us a pretty big hint. It points to a history of professional rivalry, of turf wars. He suggests that while chiropractors and osteopaths were busy refining these techniques, mainstream medicine was still catching up, sometimes with very crude methods. That kind of history can create a lot of tension and make people reluctant to adopt another profession's terminology. And really, that's the core conclusion of the paper. The evidence strongly suggests that the actual clinical problem, the dysfunctional spinal joint, is real, and it's widely observed. The conflict isn't truly about the science or whether the condition exists. It's a battle over words, over professional history, and at the end of the day, over the politics of who gets to define and own a certain part of healthcare. Which leaves us with this final thought to chew on. If a patient shows up with a specific problem in their spine, and practitioners from different fields can all identify it and successfully treat it, how much does the name they write down on the chart really matter? It's a question that cuts right to the heart of this entire debate.